the latest broadcast of HBMA Live. We've got a couple of guests here today who are going to talk with us about efforts of the HBMA Data Science Committee. So I'd like to introduce Ron Decker. He's the president, he's founder and CEO of Innovative Healthcare Solutions, and Sumit Mahendru, he's CEO of Savi Group. They're both members of our Data Science Committee. They've been involved in efforts to develop new benchmarks for HBMA. But before we get in that, I also wanted to have you have a chance to actually meet Ron and Sumit, get to know who they are and how they've been involved in HBMA. So welcome, Ron and Sumit.
Thank you.
Thanks. Good to be here.
Good to have you as well. So you've both been involved in the RCM industry for a number of years. You know, Ron, what was your path? How did you get involved in revenue cycle management or medical billing?
Well, it's a little bit of a backwards path, and it's kind of an ironic story. I was actually on the health insurance side and was calling on different companies. And one of the companies that I called on was a large and growing revenue cycle company. Back then, it was called a coding and billing company back in 1987. And started talking to them about, the benefits and creating a health benefit plan. And after the presentation, the president of the company looked at me. He said, "Have you ever thought about switching industries?" And I said, "Well, what are you talking about?" And he said, "Let me tell you about our industry. It's kind of new." And a year and a half later, we kind of worked some things out, and I went to work for a company that became one of the larger revenue cycle companies over the years. Mm-hmm. That was in 1989, and in 1996, had an opportunity to start up Innovative Healthcare Systems. So founded that in 96, and we became a RCM company and been involved in HBMA for some time.
Wow. So you're probably one of the earlier members of HBMA then.
Yes.
So in fact, probably when HBMA had different names in the past.
Well, it was a little bit earlier. It was right after I think it was the IBA, and then we became the HBMA during the beginning of my tenure here.
That definitely goes back to the beginning.
Yeah.
And how about you, Sumit? So you're a little bit newer, but Savi Group has been a member of HBMA for a number of years as well. How did you get involved in medical billing, though? I understand you have kind of an interesting backstory before medical billing.
Yeah, I have an interesting path as well to medical billing. I started out in entertainment, doing sound and music for film and TV, and transitioned to operations through various industries before coming to healthcare and revenue cycle. Mm-hmm. It was more forced work. My mom started Savi Group actually. And during the time around 2015, she needed some support in operations. And she said, "Well, I know where I can get someone cheap, where I could force him to work extra hours, work as much overtime as I need. Like, he can't complain. He's not going to sue me. Let's bring him on." So that actually was my unique path into revenue cycle. But, being in revenue cycle for the last now, it's a little over 6 years now. Mm-hmm. It's been amazing. Being part of HBMA, I think I've been with HBMA for 3 years, while Savi, I think, is way, way longer. I think Savi's close to 10 years. Just working with everyone here, being around everyone, it's been amazing, and it kind of helped me on my journey to become the CEO of Savi and kind of help take this company to the next generation.
Well, thank you both. Yeah, welcome. And Sumit, we won't put you on the spot and ask you to list the movies you've been involved with. But those who go to Dallas, they can pull you aside and have a conversation over cocktail and coffee. So.
Sure, anytime. Happily do it over coffee or a cocktail.
There you go. So, and you're both involved in the Data Science Committee. Ron, I think you might even have been a charter member of that committee.
Yes. A number of years ago, the HBMA had an initiative that was a new business strategy initiative where they were really trying to reevaluate HBMA, its membership, and where the industry was going. As I used this term during that interview process years ago, that revenue cycle was becoming like a pool that was a mile wide and an inch deep. And we were trying to, as an industry and an association, really try to figure out where we fit in that. And a lot of the membership at the time at HBMA felt like we were spreading, and we really fit in a lot of different places. But what's happened over time is we've had to go deeper. So we're a lot deeper now than an inch deep, but we're still about a mile wide. And so one of the things that I had the opportunity, I actually got involved with HBMA, went to a conference a while back, and Gene Gilreath, the former president, somebody that I have a lot of really high regard for, had got in front of the podium before one of the sessions and really challenged all of us, said, "Look, we're here learning today because people before us spent time, energy, and effort getting involved in HBMA and really bringing educational content, experience, and that sort of thing to the industry.
Right.
And so she stood up there and she said, if you're not involved in a committee, you're really absorbing things and not giving anything back. And that's just not right. And she was right. And she was speaking directly to me. And so in the next networking break, I went out and I said, look, that you hit me between the eyes. I've been sitting on the sideline for a number of years. And again, this was back in 2011, 12. And so I got involved, and one of my passions was commercial payer relations. And then the other one was really new technologies and evolving industries. And so as a part of that, was chaired the new business strategy group, and out of that formed the suggestion. One of the suggestions from the consultant was to form a data science committee, or back then they called it a big data committee. Mm-hmm. And so, having been involved in that, I got the short straw and became the chair of the data science committee at the beginning. So that was my a beginning in the data science committee, and how my involvement started.
Great. And for you, Sumit, so you're newer to getting involved in HBMA, but what attracted you to data science?
I've always, in every industry I've been in, I've used data to improve operations. And kind of when I came into RCM, I realized that not everyone, there was really no standard. Everyone was it was a wild, wild west when it came to data. And joining the data sciences committee, I wanted to see how others were doing it, get some ideas, and really help breed innovation. And a lot of the things we do together when we're talking about different metrics, and we're going to go through them later today, but talking about the different way we look at things, the different terminologies we use, just from the terms of what a field may be or what a denial may be defined as, has been eye-opening to me. And kind of being able to work with my peers and do things that can help other businesses, small and large, has been the reason I came into it, and kind of wanted to broaden my horizons and polish the way I do things here at Savi.
Well, we appreciate that you both, contributed immensely to the committee. So the committee, data science, is one of the committees I've actually worked with directly too, and it's been a learning process, I think, for all of us. But I think we've come a long way. So I understand historically, Ron, that the HBMA has done surveys, and in the past they focused more on billing fees, which we've done that survey. Mm-hmm. We relaunched it last year. But the discussion with the committee was about what else, what can we do, what's next?
Right. Yeah, and some of this too. And I have my original talking points that I shared with the board years ago when we launched the data science committee. And I think it's important for the membership to understand that this really is, as a lot of committees are, this committee and the work that they're doing, it really is challenging, because as Sumit just mentioned, the variability across companies, the size of companies, that sort of thing, it's pretty daunting to try to come up with standardized questions that we can come to. But I really think it's important. Let me just take, this is a 2 or 3 sentence. This was the original charter that was approved by the board back in 2016 and 17. And the charter reads, the mission of the Data Science Committee is to be an advocate for HBMA membership by establishing directives, utilizing emerging analytic and technology tools to aggregate confidential data for measurement and benchmarking for the benefit of the membership. In addition, data science will lead the efforts in administering core work groups that involve collaboration with industry organizations that administer information to our membership, that reduce costs and alleviate administrative burden. By establishing these tools, our membership will benefit through the measurement of themselves against objective and non-proprietary RCM standards. Well, that sounds really good. And when we meet on a weekly basis, and we've got a really good group, Sumit is one of the best and brightest up-and-comers in HBMA, I believe. We've got some gray hairs like me in the group that have been around for a long time. We have small groups, we have larger groups, and we have an actual analytics person on the committee as well. Right. But one of the things that we really try to encourage people to do in the committee is, let's make sure that we're all talking the same language. And Sumit mentioned the denial appeals. We've had a lot of debate over rejections. We've had a lot of debate over these things. And one of the things that we want to do is we want to take that input from both the board and from members but we want to encourage people to be a little bit patient as we work through it, because it may be potatoes to some, but it's potato to others. It's tomatoes for some, it's tomatoes for. And we need to really make sure that we're getting the right information and definitions on these surveys out. So be patient with us, and also be an understanding. And we challenge you to challenge us a little bit as we walk through this process.
Well, it's important, Rob, because it is a process. It's, we've got a new survey that's going to be launching in the next few days, but it's, the first round of this survey, and it will evolve over time. And we may find after it's launched that there are things that we all understand in terms of definitions or terms that aren't clear. One of our board members actually shared the draft survey with some of her frontline staff, and we got back some interesting feedback just from that interaction.
Right. Yeah, it is very difficult, and I'd love to have Sumit comment on this too, because one of the other challenges that we have in this group is, I'm years ago I would sit down and try to enter charts that were coming in with paper, and my staff would come running in and say, "Get away from the computer! You are not allowed to do that. You're screwing up everything that we're trying to do here. Go do your deal." I wasn't smart enough to be able to work through that. And so one of the things as an owner, we get used to doing the things that we're doing on the business, but in the business sometimes is what we're assigning these surveys, and we need that input. We have to make sure that not only are we educating the people that are doing the surveys, but we're also listening to what's happening at ground level. It's really a real direct effort to try to get real-time, real-life information into a survey that's beneficial to the membership. But Sumit, I'd love to hear your comments on that as well.
I couldn't agree more. I think that, as companies get access to the survey, give it to different teams, give it to different members of your teams, because everyone thinks differently. Everyone might have different terminology, different ways of doing things, may have a different benchmark and idea. But like you said, challenge us, because we want to be able to give the best advice to the industry as a whole. And that only happens with transparency and communication and teamwork. And that's kind of what our membership is great at doing. We all work together. We all share our inputs. The board has shared a lot of inputs on the survey as well, and it's just improved it and improved it and improved it. We spent, I think we spent 3 to 6 months on this survey, just going through the right ways to do it, the right words to use, going back and forth, and like Kurt said, testing with different people, testing with different people in different positions. I'm like you, Ron. If I go start entering claims, my team will come and yell at me right away. Get off of it. Stop doing what you're doing. Walk away. Hands off the keyboard. Stop.
That's right.
Away. Right. So I think it's important that we involve everyone we can, because the more people, the more feedback, and that's how we're going to improve this industry. It's ripe for change, especially with everything that's happened over the last year. It's ready for change, and we're all being forced into a new normal. So these surveys and these data science things that we're doing and we're looking at, and these questions we're asking, are going to help all types of businesses, sizes small to big, prep for the future.
Right.
In this case, it's designed for them to assess how they're performing too.
Exactly, and how to improve.
And how to improve, exactly. See where they are now, see where their colleagues are, or the companies are, and how we all move forward together. And it'll be interesting, because you can, depending on how you participate in the survey, you'll have an opportunity, companies will have an opportunity to, create a profile where they can get their own data, or they can do it totally anonymously. And either way, the data is anonymous. We're not attributing data to any specific company, right? But those who want the profile, they'll be able to look at their data and compare it against the sort of average responses. They can keep track of it and do that on their own, but it's nice if they create the profile, they don't have to worry about that, because their data will change over time too. So, but with that, Sumit and Ron, you want to tell our viewers a little bit about the survey and how we've structured it, and what our plan is for the next few months in terms of not just this survey, but some follow-up surveys we're going to be doing.
Sure. Ron, do you want me to take the first one?
Yeah, go ahead.
Cool. So our first survey, we're looking at performance metrics related to AR, revenue, and expense. And I think that this is the perfect first survey, especially as companies are opening back up, understanding what has gone well. We're looking at quarters of data or half years of data, what has gone well, what hasn't gone well during the work from home period. helping them track, like you said, Kurt, now first time, which we've never had before, they can log into the portal and look at their data against others. They don't have to do it manually anymore. This is something that hasn't been there. But I think the AR revenue and expense is really the most important thing in any RCM company. Being a business leader and business owner myself, I need to know what my expenses are, what I'm going to earn. I need to be able to sell to providers to showcase, hey, this is where I am against the industry. Mm-hmm. Am I doing better or worse, or am I in line with standard metrics and benchmarks throughout the industry? Some people may call them KPIs, some people call them metrics, some people call them benchmarks, but at the end of the day, it's all the same thing. And it's something that will help us not only give better advice, but also help businesses track better, see where they're doing well, where they're not doing well. Some of the questions in there are very, very strategically placed that'll help end businesses look at things that they may not be looking at currently.
Mm-hmm. Yeah, and I think it's important too, from somebody that's been in the position as a CEO for a while. I used this in a presentation that I did a while back with some hospitals in a certain region of the country, and we hear it forever. It's measure, monitor, and then adjust. Mm-hmm. MMA. I think that's really important with this. I know I used to go to conferences that HBMA would put on, and you'd have a sheet of paper and start writing ideas down. And by the time I left the conference, I was so overwhelmed that I would get back and I just think I got to chunk this up a little bit differently, because there's too many things for me to look at, and I felt like we did a pretty good job. And so I think it's important as members begin to look at this survey information. We really have, with this first survey that's going to be rolling out, I guess on the 7th is what I've heard.
Yeah, that's your goal for next week.
Yeah,
I think provider is making some changes to its system this weekend, so I want to make sure we have a couple days
to check it out and make sure everything's working. Yeah.
Exactly. Yeah.
And so I think that the thing to look at is we've tried to break these down and make them bite-sized for a reason. We want people to be able to get the information in, and then get out, and then we can look at the information as it starts to be portrayed, and you can look at it, and it's bite-sized for two reasons. One, it's not daunting to get the information into the system, but it's also not daunting when you start to get the feedback out that you can measure and then monitor. And then make your adjustments as a HBMA member and a billing company owner, no matter what size of company. We felt like we're the most standard common denominator metrics that we could start with. And so I think that to keep that in mind, I think is very important.
Right. And we also structured the survey so we can get the data out as fast as possible. So we've got, I don't want to bore you all with the legal requirements, but there are guidelines from the Federal Trade Commission that makes us wait before data can be released. It needs to be aged by a certain amount of time. Well, this data is being collected so it's outside of that window of 90 days. So we'll be able to actually publish it much faster than having to wait for that data to age like we had to do with the billing fee survey.
Right.
And so what's coming up after the AR survey? Ronnie mentioned that these are in bite sizes, intentional.
Right. Yeah, we're looking at the salary survey. That's one of the things right before the call that we've got a couple more that are coming up. We've got the performance metrics around denials is one that we've already started, and I guess there's some and we're like everybody else. We're trying to adjust to the market as quickly as we can, and some of the feedback I guess HBMA and Kurt has been receiving is around industry salaries. What are some of the standards within the organization? So I would assume that will be something that we may move up ahead of the denial. We've got the denial information that we've worked through, but that would be something post this webinar today. If you've got some strong feelings in the comments, which one you would rather see before, that might change a little bit of our response. But the next ones we've got are denial percentage. We define what I consider to be a denial, and this was one of the other. Sumit is grinning. We all went toe to toe a little bit on the difference between rejections, actionable denials, things that are just notice related, and really how to measure that. And so we do spend a lot of the time really trying to break this down and look at it in a number of different ways. But we've got that survey pretty much keyed up and ready to go, but we'd love to have your input as a HBMA member on whether that would be the next step or whether we need to work on the industry salary information.
Yeah, if there are any listeners and watchers who want to go ahead and send a question to us, we're ready. We'd be happy to take questions from the audience. If anyone has a comment they want to share or question they want to pose to Ron and Sumit. And we don't have to sit here and wait. Maybe it's all crystal clear for them and they don't have any questions. Ron, I also appreciated earlier on you talked about the value of getting involved, and that's something that our HBMA members can do, so they can get involved in the data science committee and other committees. Mm-hmm. It's a way to actually make sure that we are being responsive to the industry and membership, and also is a way for members to give back to and get engaged and to network.
Well, I have a follow-up to that too, and a number of these committees, we've always done them by teleconference, and with the we discussed years ago in HBMA moving to Zoom way before the pandemic.
Yeah, you're right.
And we didn't really do it, and now that we really feel like it's enhanced the ability to communicate, but not just communicate, but really interact and have a relational aspect on these committees. And I think if HBMA works it the right way, I really think that the future related to committee work, it is less intimidating. It's just not a phone call. Everybody's engaged for a shorter period of time. And I really think it's created a better overall product, if you will, especially in the data science committee. I'd love to know, Sumit, your involvement and what you feel about that specific issue.
I think the Zooms have been wonderful. I think it's great rather than doing, as like you said, as we started, we were just doing phone conferences, but it's great being able to see people's reactions on their face, see that we're more attentive on Zoom for that hour we're on with the data sciences. And I think since we've transitioned to Zoom, we've hit the ground running. We've gotten so much more done together. Because we're not just waiting saying, hey, do you have a question? Do you have a question? You can see people's faces. We can see people nodding back and forth, whether they agree or disagree. It's given us a better interactive environment. And it's been more consultative together rather than just one person talking. I think before that, it seemed to be, depending on the call, it was 2 or 3 people talking only. And now we see everyone talking, everyone engaged, everyone putting in their inputs. And I think that's huge.
It's a great contribution.
Yeah. And I do see a question from Amber in the comments. Amber, it'll work for both, because really, whether you're a practice or an RCM company, there's still a revenue cycle going on no matter what, whether you do it in-house or outsource it. And if you're doing it in-house, you need to follow the similar metrics, and there's similar benchmarks that should be followed. And also, if you're overseeing an outsourced third-party RCM company, what do you need to look at from them? What do you need to track from them? What questions should you be asking from a data standpoint? What type of reporting should you be getting from your third-party RCM company? So I would say these surveys will help anyone in healthcare who has RCM services in any way.
Right. And that's a good point. The survey is open both to members and non-members alike. So those companies that participate, if you're a member, you'll get the report for free. If you're a non-member, you'll get the report at a small price. And if you're a member who doesn't participate or a non-member that doesn't participate, there'll be a fee to get the report afterwards. But the reason why we structure that way is to really encourage members to participate. We don't want this to necessarily be a big revenue driver. We want the good data. And so that's why we're motivating people, whether they're companies, whether they're members or non-members, to participate, and they get that sort of economic incentive as well as the incentive of getting these performance benchmarks.
Yeah, and I would add to both of the comments that were just made to Amber. One of the things that we're looking at, and when we started this process, was we understand revenues. We are the only association that of our size that's totally focused on provider revenue cycle. And so we kind of stuck our stake in the ground and said, we are the benchmark for RCM. And one of the things that we wanted to do with that is to say revenue cycle is not just for individual billing companies, but revenue cycle crosses the gambit. It affects the group practices that do their own billing. There's a lot of different people that the metrics that we are setting up and designing are about the metrics, not about who's doing it, whether it's an office practice, whether it's a billing company, whether it's a MSO at a hospital. They are metrics that are designed because they're revenue cycle metrics. And I think that's a great question. And I hope between the three of us, we kind of responded, and I just saw the response. So good.
And that's a good point, Ron. So, our original membership were the revenue cycle management or medical billing companies, as they were historically called. But a few years ago, HBMA created a new category of membership for those central billing offices. So it is possible for them to get involved in HBMA too and be a member. So we've got both. We're sort of agnostic with respect to that.
Right.
As well as if you're an individual proprietorship, we have an individual membership. If someone's out there as a company that is really sort of doing the revenue cycle management, medical billing on their own, they could become involved in HBMA too for individual membership.
Yep.
Well, Ron and Sumit, thank you so much for joining us. We really appreciate this. I hope this has been helpful for everybody. Watch out next week. If you're a member, you'll get an email notifying you when the survey's launched. If you're a non-member, we'll be putting posts out on social media, on our social media feeds, especially on LinkedIn. And we hope that we'll have a lot of participation. That's what really creates the value in the survey. And then watch for the follow-up modules of it. Again, the first one's on AR. We've got the survey on denials. The module focused on salaries. And if you got an idea for another module, please send us in. And I see another comment coming in as well from Cindy Pittman. Thank you. It's been great. Cindy, thank you for watching us. And I'm sure your company will participate as well.
Yeah.
So. Ron, Sumit, any parting thoughts for our viewers?
Ron, after you.
Yeah, I'm just appreciative that HBMA is really pushing this initiative forward. Again, this is not going to end with this. This is a kind of a concentrated effort around the surveys that we're looking at right here. But we truly believe that in the future that the membership will drive additional surveys to allow us to update year over year. And again, our focus is to make them understandable, bite-sized, so that you get more participation and more valuable data as we go through. So I just encourage everybody to get in and get involved with HBMA.
I couldn't have said it better, Ron. You hit everything on the head. And anyone who'd like to join data sciences, we love new voices. We'd appreciate more and more involvement from our membership. So looking forward to more and more together, and looking forward to seeing everyone at the conference in person this year.
Yeah.
Looking forward to seeing you both in Dallas too in September.
Yeah.
So if you want to get involved in HBMA, you can also send us an email to info@hbma.org. And also hope you'll tune in next Thursday at 12 Eastern. Take care, everybody. Be well.
All right. Thank you, everyone.
Thank
Take care.
you.
All right. Bye.